Hi guys, so another day, and today I am here in front of you to discuss a couple of relevant cadaveric images, which are again relevant for the exam because if you check out the recent INI-CET paper and then the prior to that the FMG one, both had like these cadaveric images which needed a lot of analysis, and rather because the time is very short, I think something like maybe 1.5 minute or lesser than that, because obviously for image-based questions you might be trying to dedicate a little more time than as you would allocate to a smaller or a one-liner question. So there you need to have a thorough understanding. So this session is primarily meant for those who will be sitting for the exam very soon. That is like the first one is FMG one, then the NEET PG one. So I think with this session, I'll be able to help you assess those cadaveric images, and I'll be doing a bit of forensic medicine images in the same as well, so that we have is a more broader and a holistic discussion related to the same. So let's get started. The objective is to talk about cadaveric images, and I have a couple of questions in front of you. The very first one, as you can see, I'll just zoom a little more so that you can check out the image. He says, which of the following will be accurately describing the anatomical extent of the attached border of the following structure. So the arrow, the horizontal one, is basically pointing towards the mesentery, and you need to select the right option with respect to the mesentery. So yes, guys, hit the comment button. I can see a lot of people in the chat at the moment. Names I missed initially. Okay, so this is Dr. Anonymous and then Dr. Purnima. Okay, triple A. So it comes coded right now, does Karthik and everybody. Okay, so yeah, I think it's a pretty straightforward one. I mean, where does the mesentery start? So one of the endpoints of the mesentery would obviously be like at the ileocecal junction. So you can pick up ileocecal junction and you sorted for this question. And the second point would be at the duodenojejunal flexure. So normally we read about the ligament or trites at the duodenojejunal flexure. That's going to be the landmark for upper GI versus lower GI bleeding. But then as far as this particular question is concerned, the answer for this would be option number A, that is a duodenojejunal flexure to the ileocecal junction. Hi, Sane, and okay. Hi, Dr. Preeti, then acetazolamide. Okay, Rahul, fine, man. I think most of you have narrowed down to the correct answer for this one. Pretty a straightforward one. He said the extent of mesentery. I had already done the marking there, the ileocecal junction. All you had to do was pick that up and be able to answer this question. So this is option is A for the current one on the scenario. And let's move on to the next one on the board. Yes, I think Abbas was another one who mentioned that rightly. Pretty straightforward, right? Mesentery, I don't think so would be causing a challenge. So let's move to the next one. This is regarding the spinal cord. I have tried to give a bit of description, which might be actually missing in the question also. And like he says, the patient has undergone a procedure for a thread-like structure that is extending from conus medullaris to the coccyx as is marked here. To make it easier, I can say that if this is gonna be conus medullaris, though in medicine, I spoke about conus medullaris syndrome and caudate venous syndrome, but today's objective is to talk about things beyond that. So we have is these nerve roots that are coming out, that is caudate vena. Caudate vena, the nerve roots would be like L1 to L5, the ones in green, and the red ones are going to be S1 to S5. And then what you can notice is the structure that I'm talking about is called as film terminal. Okay, I'm getting A as an answer to this one. So first and foremost, the guy was having a condition that is called as tethered cord syndrome. In tethered cord syndrome, what happens is that this anatomical structure by the name of film terminal is relatively smaller in size, so it will stretch the spinal cord of the patient. Film terminal is something that will be ending at the anococcygeal ligament. So this film terminal is composed of dura mater as well as of the pia mater. So here it is saying it is composed only of dura mater. So this is not correct, because this will be having dura mater as well as the pia mater. No arachnoid, because there is no CSF, right? But this would be having dura mater as well as the pia matter, so this is wrong. Now it's a distal part of it is called as coccygeal ligament. That makes sense because I said it ends at the anococcygeal ligament. So this can be okay statement. It may not be okay. Let's read up C. He says it does not extend beyond the sacral hiatus. So I mean, this would be going right up to the coccyx. So I can rule out, I mean, A and C from this, and the spinal cord length is 50 centimeter, not the length of the film terminal. So if I just go by a bit of my gut feeling, a bit of instinct, then I can narrow down to the correct answer to this. That is, this would also be called as coccygeal coccygeal ligament, that is filum terminal. So all you have to do was identify this tail-like structure at the end of the spinal cord, which is not conus medullaris, that is filum terminal. And filum terminal is gonna be like the distal part of it is called as the coccygeal ligament because it ends at the anococcygeal ligament. So even if I had not given the description of conus medullaris in this question, even if I have not mentioned the coccyx, you should be still be able to figure this out on the basis of like the line diagram or the anatomical specimen that is shown to you as they put up these specimens. I mean, it's not possible to go through all the specimens, but what you need to do is just use some instinct, some gut feeling, and you are able to work down to the correct answer to this one. So I think like we had a divided house between A and B, and the correct answer for this one is option number B. So we are sorted for this, and we move on to the third one. Here he is asking you regarding a nerve which is adjacent to the common carotid artery. If I zoom into this image, you can notice that this is the arch of the aorta, and then adjacent to the arch of aorta, what you can see is obviously the vagus nerve. But if I do the markings here, okay, this is arch of aorta. This would be the left common carotid artery. This is the right brachiocephalic trunk, and from this there would be a common carotid artery and the right subclavian artery that would be originating. So he's talking about this anatomical structure, that is the vagus nerve, that is traveling adjacent in the carotid sheath along with the common carotid artery. In the carotid sheath we are having internal carotid artery that would be present medially. Then we are having the internal jugular vein, that is laterally and posteriorly is the vagus nerve. And you have to pick up like which of the following are the incorrect statements in this case. I'll pick up the correct one to make it easier for you. That is the vagus nerve originates from the lateral aspect of the medulla. So this is an okay statement. I mean, it makes sense, point number 3, but then we need to work out the remaining ones, which is left-sided nerve loops around the arch of the aorta. Well, as far as the left-sided branch is concerned, we have a recurrent laryngeal nerve, right? The recurrent laryngeal nerve is a branch of the vagus. It loops around the arch of the aorta. So this is also a correct statement in this case. So 2 statements are correct. And now you can see there are 2 that are wrong. So I'm left with 2 only. The traveling part is anterior to the lung hilum. No, guys, the vagus nerve, when it's traveling in the hilum that is adjacent to the lung, then it will be present posteriorly. So here the wrong word is, it is written anterior to the hilum. It is actually posterior to the hilum. And right nerve has a longer course than the left. No, left is longer. The left vagus nerve, because it has to arch around ना, क्योंकि उसको left recurrent laryngeal nerve का branch देना है, so it has to loop around the arch of aorta. So the L से left वाला जो vagus nerve होता है, that is longer as compared to the right vagus nerve. So there are 2 wrong statements in this one. It is wrongly written. Right is longer than the left. It is the left vagus that is longer than the right, and the position of this in the hilum is posterior. So there are 2 wrong statements here that I need to pick up. That is 2 and 4. So that helps me evaluate the answer, guys. I mean, the correct answer for question number 3 is option number D. In the chat I got, I think A, B, C. So I think everybody tried to work up the data. I can't be C, man. There is no 5th choice there, na? I mean, it cannot be option number C, because 3 and 5, there's no 5th option here, right? So sometimes like you just have to keep your presence of mind there, because 2 things were correct. So all you have to do was rule out the 2 options. Otherwise, like, you know, racking your brain on this, what is anterior and posterior, either you be very, very thorough with anatomy, or you try to do exclusion skills like I was doing, that I was able to work out one option right away. The second option, with a bit of deliberation, I was able to work out. And then, like, you know, the remaining part, I was able to figure it out subsequently. So the correct answer to the third question on the discussion today is option number D. A bit of practice and you will be on your way to get these kind of questions right. But head and neck anatomy, guys, is like hardcore data that you have to be good with. Most of us study upper limb, lower limb, तो वो तो ठीक है यार, upper limb, lower limb तो सभी करते हैं, right? Do head and neck, do pelvis, and you'll be on your way to get to the right answers. और अब मैं pelvis वाला question ही पूछ रहा हूँ, बड़ा favorite है, right? Structure marked here, तो मैं मतलब बोलूँगा ना तो answer obvious हो जाएगा. So just putting a star mark for this. A couple of muscles which are present below this also. So I'll utilize this opportunity while you guys are commenting on the answers here to actually let me know with respect to like what are the structures is. So at the moment, what I'm talking about is gonna be this nerve fiber, this muscle fiber, that is muscles which are gonna be called as quadratus femoris. And the second one that I'm talking about that is present a little superior to this, that would be called as obturator internus. And the muscle that is present where the arrow in black is present, that is gonna be piriformis. They always love to ask about this question on the topic of piriformis. So the message here is that you have to work out what is the correct statement that is true. So the nerve to, I mean, the structure that we're talking about here, the arrow is put at piriformis. That is very clear. Piriformis syndrome is what we deal lots of time clinically with patients who are having low back pain. And when it comes to piriformis, yes, I think the moment I said piriformis, I'm having spot on answers. Pudendal nerve passes below it. So he says the correct statement for this one is option number C. And this is not, I mean, this muscle is a lateral rotator of the hip, right? So that's why option number D is wrong. And nerve to obturator internus passes above it. The muscle is below now, so the nerve to that will also be passing below it. And the nerve roots related to this would be basically S1 and S2 and not L5 and S1. So the correct answer for this question is option number C. Okay, guys, so now we have a question which I think is more of a FMG kind of a question. This has been asked in FMG exam. They always love to ask you regarding corpus callosum. That's the anatomical structure that is going to be connecting the left and the right cerebral hemispheres. And all you need to do is figure out for me the rostrum of the corpus callosum. So let's look at your answers for this one. Pretty straightforward. Yes, this is going to be anterior. एंड ये तो पीछे है ना, जैसे सेरिबेलम हो गया तो ये posteriorly posterior हो गया. This is gonna be the pons, then we have the midbrain, then we have the medulla, and you can see a anterior and a posterior structure. He says which structure is called as the rostrum. So rostrum would be आगे, this particular area would be called as the rostrum. And ये जो पीछे वाला होता है area number A, this is what is called as splenium. So I think this was in FMG exam, maybe in a MRI they asked this, that the posterior part, that is point number A, that is marked, they put an arrow in that, then you will say splenium. And if you look at point number D, where I've done the marking, this particular area, the anterior one, this is what would be referred to as the rostrum of the corpus callosum. So the correct answer for this one is option number D. Okay, good job, guys. I think this was just had to figure out the anterior and the posterior part. And what I will do here is, just for the clarity of this PDF, I'm gonna not write the word A and P because that might make you look like, because they're already alphabets like A, B, C, D present here. So what I'll do is just put in the word anterior and posterior, and you are sorted for this particular diagram. It's just that you can pick up C is the genu. The C is the genu of the corpus callosum, then is gonna be like the rostrum, and posteriorly is the splenium present. So I mean, the way you had to figure out was just what is anterior and what is posterior. Otherwise, that swapping can occur between A versus D. Like in this discussion, I did have A as an answer. That was simply because if you don't look at the anterior and the posterior part, the swapping part will occur, and that will cause error of judgment for this one. So we sorted for the fifth one. Okay, we move on to an easy one. The patient is having that stardew spots in the eye. So I said a bit of images from a dead body as well. From the forensic perspective, the stardew spots would be seen in the white of the eye, that is the sclera. He says like this would be seen on visceral surfaces and would be seen with respect to mechanical asphyxia. So easy one among the options that are given. I mean, mechanical asphyxia, the congestion part, that's where we can see these blood vessels, and we can some petechiae also. But in this one, it's the tardive spots, which is to be remembered. So spot diagnosis for question number 6. I mean, I would say not very significant effort had to be done to solve this question. The next one is with respect to throttling, and he says it will cause, I mean, substantial amount of injuries on the neck. There would be like copper penny bruises that can be, and at least penny bruises can be present because of the mark of the thumb and the fingers that would be putting pressure on the neck of the patient. So minimal injuries is like a wrong thing here. And then key postmortem findings include only superficial bruises and no internal. They could be internal injuries also. No? They could be internal bleeding with respect to the muscles here. So he's saying which is the correct one in this case. He's saying, guys, in a throttling case, which is a correct statement, so throttling cannot be suicidal. And there can be internal bleeding also, no? The muscle hematoma, there can be a muscle hematoma that is occurring. So all you need to pick up is, why does it cause death in a patient? Because 2 minutes of this kind of an asphyxiation would contribute to either asphyxia or would contribute to a vagal inhibition in a patient. So the correct answer in this case is option number A. I mean, statements given correct in this case is either asphyxia or vagal inhibition with 2 minutes of pressure. That would help you, or that is like the cause of death in this case. And I mean, hypoxia-induced cardiac arrest is what we're talking in this case. So I think was an easy one. Again, the 7th one. Let's move to the next one. This is, I think, I can be identifying this very easily grotesque image. So I was thinking whether to put this or not, but you can pick up this would be gagging, and that gagging can again cause an asphyxial death in a patient. So eighth is sorted. Seventh was like a bit of logical one. Eighth was more of a spot on one. Let's move to the ninth one, where you can see opisthotonus. The moment you pick up opisthotonus, you know that the answer in this case for opisthotonus would be given as kernicterus. The correct answer, I mean, in pediatrics, it is kernicterus, but in this case, this would be strychnine poisoning in a patient. So, I mean, very like, characteristic extensor spasm that you can see in a patient. So again, is a spot and a easy diagnosis. Okay. The next patient, like this happened, I think recently in Rajasthan or somewhere where gas geyser was being used, and using that gas geyser, you can pick up this cherry red discoloration. So this would be again picked up. That would be carbon monoxide poisoning. Though the guy could have been saved in this particular patient, that would be saved primarily because of I mean, if they were detected on time with hyperbaric oxygen therapy. So the cherry red is more going, not red, it's like cherry red. So that's why like the cherry red part is giving us answer as carbon monoxide poisoning, for which hyperbaric oxygen therapy would be used. Okay. Yeah, absolutely. Moving to the 11th one, we have this cadaveric image where you can see hypostasis, that would be liber mortis. And the moment I say hypostasis, it's very clear that the guy has died and therefore the blood is pooling in the periphery after a cardiac arrest in a patient. 11th is blood pooling due to gravity after a cardiac arrest. So again, an easy one to be picked up here. Yeah, I think you were able to get this one. These comments should be faster, guys. I mean, the 10th and the 11th one should not be causing any issues in answering them. Okay, fine. So analytical one, which of the following is the most reliable finding of wet drowning? You can see that cadaveric spasm, right? The guy might have been trying to hold on to some weeds. Then there's a soddening that is also present. There is some frothing that is occurring from the mouth and the nose of a patient. Like अभी अभी dead body लेकर आए हैं, and you can notice frothing. There's a cadaveric spasm. That there's gonna be soddening of the skin present. I am getting A as an answer, guys. I think I've explained this even in the test, and I mean, I think a lot of you who might be joining in might have joined the test and the explanation part that I'm conducting. And I had discussed it recently that cadaveric spasm is not the answer in this case, because cadaveric spasm is, I mean, sometimes if he dives into water where there is no vegetation, then cadaveric spasm may not be present also. The most reliable finding for drowning, wet drowning, would be that there would be frothing from the nose of the patient and frothing from the mouth of a patient. I mean, if a dead body is brought to me and there is frothing from the mouth and frothing from the nose, that means that the guy has died because of drowning. The correct answer for this case is option number B, guys. Just read up the drowning part again. They love to ask about wet drowning and the dry drowning part. The dry drowning part would be laryngospasm. Yeah, washerwoman hands. Yes, that can happen. No, I mean, you put your hands in water for long duration, even you and me can have that soddening of the skin and a washerwoman hand present. So it's gonna be like the frothing in the mouth, which is the frothing from the mouth, frothing from the nose. That implies that water went in the lungs of the patient. So no, doctor, check your notes again. Cadaveric spasm is not the reliable finding of wet drowning. In fact, you can, like, you guys use chat GPT, bhai, use karo. है ना, तो use it for educational purposes, or like you check out your notes. It's not cadaveric spasm that is gonna be the reliable. This is the commonest mistake that people make. And when I made people revise forensic medicine, we discussed this aspect related to the drowning part, that cadaveric spasm is not the reliable finding. Check out your notes again, and that understanding part has to be clear. Dead body पुलिस लेके आई ना, तो आपने हाथ वाला नहीं देखना, right? It is gonna be the frothing from the mouth that is to be picked up. Okay, a pattern of discoloration मुझे नहीं लिखना चाहिए था, but still you can notice the pinkness of the hand present here. अब I should not have said the word pink there, but since I have said the word pink, I think the answer will become very obvious. That is, this is arsenic नहीं है बच्चे, come on. Not every question is arsenic, come on. मैंने बोल दिया pink hand है. Pink hand would mean that there would be acrodynia in a patient. That is gonna be mercury. बच्चे, this is 13th is option number B. This is not lead में तो बर्टोनियन लाइन होता है, उसमें तो बेसोफिलिक स्टिपलिंग ऑफ आरबीसीज होता है. हाथ में रेडनेस है, पिंकनेस है, that is gonna be mercury poisoning, that is gonna be like pink acrodynia, the pink hand that you read, that is acrodynia as a presentation. आर्सेनिक में तो वो फिर अलग होगा ना, उसमें तो हाइपर केराटोसिस भी होगा, हाइपर पिगमेंटेशन भी हो सकता है और हाइपर केराटोसिस प्रेजेंट होगा, या मीना माटा डिजीज, राइट? Our shoe got it spot on there. So the correct answer for the 13th one that we're discussing is the pink hand, that is acrodynia. So 13th is sorted. And do check this out. Raindrop. Okay. Raindrop pigmentation is again what you read primarily with arsenic. We're talking about mercury at the moment. So yeah, Hatter shakes is what I can take into consideration. Next is putrefaction in a body. Horrible image to look at. Putrefaction would mean that there would be Clostridium perfringens growth present here, and if there's gonna be like Clostridium perfringens, the bacteria will be having lecithinase, and this lecithinase would be responsible for this destruction of the tissue. So the correct answer for this one is not collagenase, man. No, Clostridium perfringens. No, it would be contributing to Clostridium perfringens would produce lecithinase that will cause myonecrosis in a patient. It will cause this destruction of the body that is happening. In fact, initially the objective was to keep this image without this horrible image, but then at the same time, like it would have lose that image. I mean, since the objective today is dead bodies, right? That's what I'm trying to dissect before you, whether from anatomical or forensic perspective. So the correct answer in this case is option number C. So in between, guys, what you've seen is like, suddenly when I jumped into a bit of analytical part, there were errors of judgment. Initially, when it was spot diagnosis, it was okay. But then, you need to minimize this. So at the moment, like I think the scores are a little decreasing. So I hope that the next question would help you increase this. You can notice, I mean, that greenish lines that are present in this case, that greenish back serpiginous discoloration that is happening. This is very characteristic. This is called as marbling. So 48 hours and the branching skin pattern that is present, the greenish hue that is present in the skin, and along with that pattern of that mosaic pattern, reticular lace-like pattern is what is referred as marbling. So the answer to 15th is option number A. Okay, so you need to check out the cranial nerve which is shown here. Yes, guys, this is the cranial nerve that we're talking about, where I put the marking here. I think you guys can comment about this cranial nerve, and they always put up a question on cranial nerve that's coming from the base. It is coming from the medial side of the medulla, because it's coming from the medial side of the medulla. That is why this would be the 12th nerve in the patient. The answer to this is 12th. This would be anterior spinal artery, that is the medial medullary syndrome is what we're talking about, and there would be tongue deviation to the same side in a patient. Very spot on for the cranial nerves at the bottom, and this is a line diagram that would anyway be present. I mean, you can check out the 9th, 10th and the 11th nerves, but then when you check out the 12th nerve would be present medially. This is obviously like the markings are 9, 10 and 11 spinal accessory, and then the 12th one that is present medially is the one that can be seen, that's originating from the medial part of the medulla, responsible for medial medullary syndrome. A question related to what I'm saying at the moment even came in the INI-CET exam, and you had to pick up with respect to this anatomical structure. This is gonna be foramen ovale, and the moment I say the word ovale, that male mnemonic would come into picture that would help you identify the data. Obviously, like the structure that would be present anterior to this would be foramen rotundum. So rotundum is transporting the maxillary nerve, but it is the it's the ovale that I'm talking about. So this would be mandibular, and this would be the accessory meningeal artery. Okay, let me put the markings for this one, 1, 3 and the 5 that would be present. So this would be male as a mnemonic, pretty straightforward. But yeah, next time when I'm gonna give you the image, I'm gonna ask you for this one, that is gonna be foramen lacerum, where nervus spinosus would be traveling, middle meningeal artery, middle meningeal vein, and nervus spinosus would be transporting. So I mean, the next time when we meet, I'm gonna put up a question on lacerum, and then we are gonna obviously talk about others also, but then rotundum is the maxillary nerve. Then we have is lacerum, where it is the middle meningeal artery, middle meningeal vein, and we have is the nervus spinosus part, and male anyway is the part for the foramen ovale. So 17th is sorted. Let's look at the 18th one. All of you do sampling regularly. So I've mentioned the radial and the ulnar sides also. Let me know the name of the vein, please. And you regularly take a sample from this. Yes, guys. Identify the structure which is shown here. This one is the one that I'm talking about. The one on the radial side would be the cephalic vein, right? On the radial side, we have is cephalic vein that we commonly cannulate. The one on the medial side that we should avoid putting a sample or like trying cannulating would be basilic vein. Basilic vein because that's gonna be adjacent to important anatomical structures. I don't want to injure the median nerve also. So wherever possible, I would try to take either cannulation from the cephalic or from the medial cubital vein. The correct answer for this is option number C, which we regularly use for whenever we are doing sampling bedside in our patient. The answer to the 18th one is option number C. Good. Moving to the next one. Body was found unconscious near a river bank, and as I told you, one of the very reliable findings for the drowning part would be frothing from the nose and frothing from the mouth in the patient. And considering that frothing from the nose and the mouth, he says like which is the most characteristic cause of death in this case. So if it's gonna be drowning, we'll be having diatoms found in the no petechial hemorrhages, no, but say that would be mainly for like a throttling or a mechanical asphyxia. It would pretty straightforward one, I think this one. Presence of diatoms in the bone marrow of the patient is like a reliable characteristic manifestation that needs to be found out. So I don't think so that 19th was like causing any errors. I mean, hemorrhage, all of these are like, you know, mechanical asphyxia, cyanoid order is again that you can rule out. So you have to pick up just a straightforward answer here as presence of diatoms in the bone marrow with respect to antemortem death in this patient. Okay, guys. So the next one is, I think I've already made it simpler for you by writing that there is no fracture of the hyoid bone. There is a ligature mark on the neck and there is no fracture of the hyoid bone. So in those cases, you guys can comment here. The diagnosis in this case would be, yes, it would be. Yes, guys, waiting for your answers there. I'm getting a B, that is a ligature strangulation in this case. So strangulation में गला दबाएंगे तो hyoid fracture नहीं होगा क्या? अगर आप बी बोल रहे हो तो स्ट्रैंगुलेशन में अगर किसी का गला दबाएंगे तो हाइयोइड का फ्रैक्चर हो जाता है ना सर। अगर आप गला दबाएंगे किसी का भी, अगर लाइगेचर से भी उसको दबा रहे हैं तो इवन देन दे ना हाइयोइड फ्रैक्चर कैन अकर इन अ पेशेंट। नो गाइज, when it comes to no fracture of the hyoid bone, that means the part that I mean the patient's body, manual strangulation, bhai, there is no fracture of the hyoid bone in a patient. Strangulation में तो fracture हो जाएगा ना यार. There would be a fracture that would be happening with this case, and this is not drowning. This would be hanging in a patient. The correct answer in this case is C. And उसके साथ में obviously like I could have shown that lee fasciosympathetic है, where one eye of the patient will be open because there could be like pressure on the sympathetic chain, so the sympathomimetic discharge will cause that eye to remain open in a patient. But because there is no fracture of the hyoid bone, they would be hanging. तो थोड़ा इसको देखना यार, इसमें जितने भी errors है, मतलब I expected you guys to hit like 20 out of 20 today. 20 out of 20 नहीं तो कोई बात नहीं, मतलब 17-18 तो सही होना चाहिए, because these are not the kinds where like, you know, we are expected to make any kind of a silly mistakes. But I hope this session is an eye opener for you to realize that sometimes we think things are simple, but we have to apply a bit of logic, a bit of instinct, and we are able to get to the correct answers. So this was like a good session, guys. I think you guys did participate, and like, you know, there's no point of just studying without doing match practice. So what I do is these late evening sessions that we are conducting, those short ones, 30 minutes ones, are mainly like 20 MCQs, 30 minutes, are mainly to make you practice various subjects and fine tune your reflexes so that you get to the correct answer, as I say always. So do check out the discussion part of this. I mean, the PDF of this would be available in the description of the video. But instead of this, I think if you can just fast forward the video and just check out I mean, you just need to see how did your answer go in comparison to what was the actual answer. Then yeah, then I think you guys would be in a better position to see your mistakes. So thank you so much, guys. We did cadaveric images for today, the 20 of them, and yes, I'll be back with much more such interactive sessions. God bless you, and keep working, keep hammering, as I say very well, and you guys are gonna do great. Yeah, subsequently, like I'll be taking that FMG class is scheduled on 2nd and 3rd. First, I'll be doing a surgery test and explanation part. So those of you who have not done surgery, I mean, invest this week into surgery, guys. We have surgery lined up, we have OBG lined up subsequently. So those are the two TNE parts that I'll be doing. And on 2nd and 3rd, I'll be doing FMG rapid revision part. So take care, guys. NEET PG doc, I've already done, you know, the NEET PG sessions, and I'll be doing them again after this also. Like the NEET PG TNE will be starting, so we'll be doing it subsequently. So take care, guys. God bless you.